Good morning, Alex and friends. I'm Grace. Today is Wednesday, November 26th, 2025, and you're listening to Alex's News. The high in Riverside today is 79.1 degrees, with a low of 48.9 overnight, so enjoy the mild fall weather. Coming up, we'll break down why the Trump EPA plans to roll back Biden's soot pollution standards, reveal the reasons behind ByHeart's full recall of its infant formula lots, and cover other key developments from around the world. All this and more on Alex's News. Stay tuned. Good morning. The EPA under the Trump administration is asking a federal court to throw out a Biden-era soot rule. Ethan's with us to explain what's happening and what it means. Ethan, what's the headline here?
The EPA, now led by Administrator Lee Zeldin, has told the D.C. Circuit that the 2024 soot standard is unlawful and should be vacated. In court filings submitted on November 24th and 25, just in the last couple of days, the agency essentially confessed error and asked judges to wipe the rule off the books. The Associated Press, carried by Yahoo Finance, reports that would restore the older, looser 2012 standard if the court acts before early February. The Washington Post adds the agency wants the court to do this ahead of a new EPA proposal expected early next year.
So what exactly did the Biden rule do that the Trump EPA now wants gone?
The Biden EPA tightened the annual fine particulate, or PM2.5, standard from 12 micrograms per cubic meter to 9. That's the tiny soot that gets deep into lungs and the bloodstream. EPA.gov shows the decision leaned on years of science reviews, including a 2019 Integrated Science Assessment, a 2022 supplement, and the Clean Air Scientific Advisory Committee's majority recommendation that the range should be 8 to 10. The Los Angeles Times notes that the final choice, 9, fell squarely in that expert-endorsed range.
Why is the Trump EPA saying that rule was unlawful?
They argue the Biden team skipped the Clean Air Act's stepwise review process for national air standards. In their filing, they call the 2024 rule a discretionary reconsideration that bypassed the formal 5-year review under Section 109D. According to Law 360, they also claim it lacked the required rigor, even though under the Supreme Court's Whitman v. American Trucking decision, EPA can't factor costs into these health standards. The agency's press secretary, Carolyn Holren, still emphasized, quote, hundreds of millions, if not billions, end quote, in compliance costs, a point the Washington Post says underscores the political pressure around the rule.
What's the timeline they're pushing for?
They're asking the D.C. Circuit to act before February 7, 2026, which is about 10 weeks from today. If the court does that, the old 12 microgram standard from 2012 would spring back into place while the new EPA drafts a replacement. Inside EPA reports the agency is targeting early 2026 to propose that new rule. As of this morning, November 26th, there's no new order from the court.
Remind us why PM2.5 matters so much for health?
These particles are 2.5 micrometers or smaller, so small they settle deep in lungs and then pass into the bloodstream. They're linked to premature deaths, heart attacks, strokes, asthma, chronic bronchitis, even certain cancers. The Guardian notes they hit children, seniors, and people with heart or lung conditions hardest, and they disproportionately burden communities of color and neighborhoods near highways and power plants. During COVID surges, researchers also found soot exposure worsened outcomes, according to coverage summarized by the Washington Post.
You mentioned the older standard was from 2012. How have pollution trends looked since then?
EPA.gov shows national PM2.5 concentrations have fallen sharply over the past 2 decades, down roughly 42% from 2000 as the economy grew. That long-term improvement is one reason industry groups say the Obama-era level was sufficient. The National Association of Manufacturers points to those declines as proof further tightening isn't warranted. At the same time, Carnegie Mellon researchers documented a bump around 2016 to 2018 tied to more driving and wildfires, a reminder that progress isn't linear.
What did experts say when the Biden EPA set 9 micrograms?
The Clean Air Scientific Advisory Committee, EPA's independent panel, said the science supported a level between 8 and 10, and that was in letters in early 2022 after peer review of the agency's assessments. That gave cover to Administrator Michael Regan to choose 9 last February, about 21 months ago. According to NPR and AP coverage at the time, EPA also estimated substantial benefits by 2032, preventing thousands of premature deaths, hundreds of thousands of asthma cases, and billions in net health gains. EPA.gov quantified it as $46 billion in net benefits, or roughly $77 return for every $1 spent.
Who's challenging the rule in court, and why?
25 Republican-led states are leading the charge, joined by major business groups. The consolidated cases include petitions from Kentucky and West Virginia, plus suits from the U.S. Chamber of Commerce, the National Association of Manufacturers, and industry groups for oil, chemicals, mining, and cement. They argue the tighter standard would block permits, deter new factories, and raise costs for families. The AP and the Washington Post report they've warned of job losses and stalled investments, especially in heavy industry states.
What do their economic numbers look like?
NAM backed an Oxford economics study projecting a $162 to $197 billion hit to economic activity and up to 1 million jobs lost by 2031. They also warned as many as 30% of counties could be labeled non-attainment, complicating permits. Texas filed its own suit on top of the multi-state challenge. Coco 5 News, the ABC affiliate in Oklahoma City, highlighted those fears alongside EPA's far smaller compliance cost estimate, around $590 million a year.
And the EPA's counter-argument on costs?
The agency says the health benefits dwarf the costs when you tally avoided hospital visits, fewer missed workdays, and better productivity. EPA's analysis put total compliance at roughly $1.8 billion, more than offset by those benefits. But in setting the standard itself, Whitman versus American Trucking says EPA's job is to protect public health with an adequate margin of safety, not to balance costs. That's why the Biden record leans so heavily on the ISA, risk and policy assessments, and CASAC's advice.
How did we get from oral arguments to this sudden reversal?
The D.C. Circuit heard arguments on December 16, 2024, almost a year ago, after President Trump took office in January and Zeldin was sworn in January 29th. The new EPA asked the court to pause the case while it reconsidered the rule. The court granted several abeyances through October 20th of this year, and then the agency came back late last week urging vacatur and remand. Law 360 says that's a sharp pivot from defending the standard to declaring it unlawful.
What are environmental groups saying about that pivot?
They're furious. Earth Justices Patrice Sims said, quote, "It's a corporate giveaway that puts profits over people's lives," end quote, in comments highlighted by AP and Coco 5. The Clean Air Task Force called it a blatant attempt to dodge the Clean Air Act's requirements for any rollback. Groups like the Sierra Club and Environmental Defense Fund argue the science and the expert panel back a lower standard, and loosening it will mean more deaths and asthma attacks in frontline neighborhoods.
Has the administration said why it's moving this quickly?
Zeldin campaigned on rolling back dozens of environmental rules, and this is a marquee piece of that agenda. Politico Pro and VOA News note the White House wants to clear out what it sees as regulatory overreach and then write its own version. The filings urge the court to act before February 7, 2026, again, just over 2 months from now, to avoid a situation where states and industries are planning around a standard the EPA intends to scrap. The agency says it's putting forward a new Soot rule in early 2026.
If the court vacates the rule, what happens right away?
The standard would revert to the 2012 level, 12 micrograms, while the EPA rewrites. That affects how states classify areas as in or out of attainment, and how they issue permits for power plants, factories, and other sources. According to Inside EPA, A return to 12 would ease short-term pressure on permitting in industrial regions. But The Guardian points out a looser standard could prolong exposure for communities already facing higher soot levels.
How unusual is it for an agency to confess error like this?
It's not unheard of when administrations change, but it is notable here because EPA had a robust record. The Washington Post reports the Biden team built its case with peer-reviewed science and advisory panel backing. When an agency tells a court it got the law wrong, judges sometimes grant a remand. But public health groups are urging the court not to vacate, warning that erasing the standard would harm people while the next rule is written.
What role did Whitman versus American Trucking play in this fight?
Whitman is a 2001 Supreme Court case that held EPA can't consider costs when setting health-based air standards under the Clean Air Act. That's why the Biden EPA focused on epidemiology and risk analyses instead of economics when choosing 9. The Trump EPA's filings try to sidestep that by labeling the 2024 move a procedural misstep, a non-statutory reconsideration, in their words, that didn't follow the 5-year review process. Law 360 and Inside EPA emphasize the court will have to decide if that framing holds up.
How do everyday people feel this? Is it mostly about factories?
It's broader than smokestacks. Soot comes from vehicle tailpipes, diesel equipment, power plants, industrial sites, and even wildfires and wood burning. The LA Times and The Guardian have both chronicled how the tiniest particles exacerbate asthma in kids, trigger heart events in seniors, and drive ER visits on high-pollution days. EPA's own projections said by 2032, the 9 microgram standard could prevent thousands of premature deaths and avoid roughly 290,000 lost workdays.
What's the global perspective here?
The U.S. debate is unfolding amid worldwide concern about particle pollution's toll. The Guardian and international outlets like Hindustan Times point to WHO guidelines that are far stricter than current U.S. levels. Globally, tightening standards is viewed as a major lever for saving lives and reducing health costs. That's why this case is getting attention well beyond Washington.
Could the court split the difference? Remand without vacatur?
It could. The D.C. Circuit sometimes sends a rule back to an agency to fix flaws while keeping it in place. If scrapping it would be disruptive. Environmental groups are urging that path, arguing that vacating now means dirtier air, while EPA drafts a new rule. Industry groups, by contrast, want vacatur to avoid planning and permitting against a standard they say the agency no longer defends.
Any chance Congress steps in?
Unlikely in the near term. Clean Air Act standards have typically been set through the administrative process, and divided government makes legislative changes hard. The American Consumer Institute and some business coalitions want Congress to play a bigger role, but the Washington Post notes courts have consistently affirmed EPA's authority to set health-based standards. For now, all eyes are on the D.C. Circuit and EPA's next move.
Bottom line for the next few weeks?
Watch for whether the court grants the EPA's request before that February 7th date, now just about 10 weeks away. If it does, the 2012 standard returns while the new rulemaking starts. If it doesn't, the 2024 standard at 9 micrograms remains in force while the case proceeds and the agency crafts its proposal. And per Law 360 and Inside EPA, there were no new filings or orders after November 25th, so we're in a holding pattern as of today.
Ethan, thanks for breaking that down. We'll keep following the court and the EPA's next steps. This morning, we're following a nationwide infant formula recall that's got a lot of parents on edge. Reporter Chloe is with us. Chloe, what's the headline here?
The company ByHeart has voluntarily recalled every unexpired can and single-serve stick of its whole nutrition infant formula in the U.S., and it's because of potential contamination with Clostridium botulinum type A, the bacteria behind infant botulism. The recall began with a narrower scope but was expanded to all lots on November 11th, and ByHeart reiterated that decision with new testing results posted late Monday and Tuesday, which is just 1 to 2 days ago. The FDA and CDC say at least 31 infants across 15 states have gotten sick since early August, and while no deaths have been reported, every child has been hospitalized.
All lots is a big move. What pushed ByHeart to go that far?
According to PBS NewsHour's coverage of Associated Press reporting, ByHeart partnered with IEH Laboratories in Seattle to test unopened product, and 5 out of 36 samples from 3 different lots contained botulinum spores. Because spores can be unevenly distributed in powdered formula, the company said they couldn't rule out risk across all production, which is why they broadened the recall on November 11th and doubled down on that message this week. ByHeart said, quote, "Based on these results, we cannot rule out the risk that all ByHeart formula across all product lots may have been contaminated," end quote. The CDC told reporters the epidemiology ties multiple illnesses to ByHeart use, but it's still analyzing lab results from unopened cans collected by the FDA.
Have regulators independently confirmed contamination in product, not just in babies?
Yes, in at least one case. The California Department of Public Health runs the Infant Botulism Treatment and Prevention Program, and they found both the bacterium and its toxin in an opened can from Lot 206 VABP 251131P2 that had been fed to a laboratory-confirmed case. That finding is noted in FDA and CDC updates cited by CBS News and Food Safety News. The FDA has also pulled unopened samples during inspections, but as of today, November 26th, it says those results are still pending, and the agency cautions that a negative test in one can doesn't clear the lot. The CDC's language has been careful, saying the formula might be contaminated, but investigators point to the overall pattern of illness, exposure histories, and that California can result as the basis for the recall.
What do we know about the infants who got sick?
Federal and state officials count 31 infants who either have confirmed botulism or are suspected cases with a verified ByHeart exposure, and every one of them required hospitalization. Illness onsets run from August 9th to November 13th, which is less than 2 weeks ago, and the CDC says there have been no deaths. The FDA listed cases in 15 states, with concentrations in Texas and California, and smaller clusters in places like Arizona, Oregon, and Minnesota, according to Food Safety News and Marler Clark's Outbreak blog summarizing FDA and CDC numbers. Officials say some cases are still awaiting lab confirmation, but many are epidemiologically linked through product exposure and timing.
Are doctors seeing more botulism than usual overall?
They are. NPR and PBS NewsHour both highlighted that California's Baby Big program, the only source of the infant botulism antitoxin, has shipped the medication to 107 infants nationwide since August 1st. That's an unusually high pace for late summer and fall, and the state program's data show that of 84 babies treated through November 10th, 36 had powdered formula exposure, and more than 40% of those were given ByHeart. It's one reason public health officials call this a significant emergency, even as testing continues.
If this all started in August, why are products still on store shelves?
That's been a point of frustration. According to Food Safety News, inspectors in multiple states still found ByHeart cans at major retailers like Walmart, Target, Kroger, Safeway, and regional chains last week, and some international Amazon marketplaces were still offering stock. The Association of Food and Drug Officials told reporters recall effectiveness was around 90%, which sounds decent but leaves a lot of product out there when the recall covers everything. The FDA acknowledged to reporters on November 20th that distribution lists from the company didn't reach state partners until November 14th, which slowed removals in the early phase. Walmart says it put point-of-sale restrictions in place, and ByHeart says it sent multiple notices to retail partners.
How big a player is ByHeart in the formula market?
It's small, but that doesn't blunt the risk. The Washington Post and trade coverage put ByHeart's U.S. market share under 1%, and the company reportedly produced around 200,000 cans a month during the period in question. Even with a small footprint, the uneven distribution of spores in powdered formula means a single contaminated can could seed a serious illness in a vulnerable infant. That's why the CDC and FDA are urging parents to stop using any of it immediately, rather than waiting for specific lot confirmations.
What exactly should parents be watching for with infant botulism?
The CDC describes symptoms that can develop up to 30 days after exposure because spores germinate in the gut and produce the neurotoxin there. Parents should watch for constipation that seems out of the ordinary, poor feeding or a weak suck and swallow, drooping eyelids, a flat facial expression, a weak cry, limpness, and any breathing trouble. Those are emergency signs. Treatment is the Baby Big antitoxin given intravenously, which neutralizes circulating toxin but doesn't reverse nerve damage already done, so early care matters. Doctors emphasize you shouldn't wait if you're concerned. Call your pediatrician or go to the ER.
And the practical advice: what should families do with ByHeart products right now?
The FDA's message is simple: discard everything. That includes all unexpired cans and the single-serve anywhere pack sticks, no matter the lot code, because the company says it can't rule out risk across any production. The agency asks consumers to report illnesses or quality problems through its MedWatch portal or by contacting regional complaint coordinators listed on fda.gov. If you need formula urgently, pediatricians and WIC offices can help identify alternatives, and retailers are supposed to be offering refunds or exchanges for recalled product.
Speaking of refunds, how is ByHeart handling reimbursements?
The company expanded its refund policy on Monday and Tuesday, which is November 24th and 25, to offer full reimbursement for purchases made on its website on or after August 1st. It's telling customers to call 866-201-9069 anytime to start the process, and says reimbursements should process in about a week. For retail or Amazon purchases, ByHeart directs people to those sellers, which drew criticism from some lawmakers. CBS News reported Senator Tammy Duckworth asked the FTC to review whether the initial refund approach was too restrictive. ByHeart says it's trying to make customers whole while it cooperates with investigators.
Do we know where the contamination happened in the supply chain?
Not yet. The FDA, CDC, and California's IBTPP are tracing back through the supply chain, everything from raw ingredient suppliers to mixing and packaging to storage and distribution, and ByHeart says it has given investigators full access to its facility and records. The source could be a supplier, a process failure, or an environmental contamination that persisted. The company's own message focuses on the spore's survivability and the way powdered products can get contaminated in pockets. Regulators haven't released genomic sequencing that ties multiple infant samples to multiple distinct lots, which is one reason they're still calling the lab evidence limited but supportive of the recall.
Has ByHeart had safety issues before?
It has. In 2022, ByHeart recalled product over concerns about Chronobacter sakazakii, the same pathogen implicated in other industry recalls that year. And in 2023, the FDA issued a warning letter citing mold, leaks, and insects at the company's Pennsylvania plant. The company says it addressed those findings and underwent new inspections. But this botulism-related recall will likely bring another round of scrutiny to its processes. The Washington Post notes that formula manufacturing is tightly regulated, yet these events show how even small lapses can have outsized consequences in infant nutrition.
You mentioned uneven contamination in powdered formula. Can you explain how that affects risk?
Sure. Powdered formula isn't sterile, and when spores get in at any point, they don't necessarily spread uniformly. Some cans, or even some scoops, may contain spores while others don't. That's why a batch that seems fine in spot tests can still harbor risk, and why ByHeart says it can't isolate the problem to certain lot codes despite testing only 3 lots so far. The FDA has emphasized that a negative result from an unopened can doesn't exonerate a production run because you might just have missed the contaminated portions. It's also why the CDC is relying heavily on case interviews and timelines to connect the dots, not just lab confirmation.
What's the outlook for the investigation in the next couple of weeks?
Expect more testing results from the FDA's unopened samples, which the agency said on November 20th would take days to weeks, so we're in that window now. States are testing leftover product from patient households, and as those results trickle in, we may see stronger links to additional lots, or not, but the public health advice likely won't change until there's a definitive source and remediation plan. Meanwhile, recall compliance checks will continue because we know products were still sitting on some shelves as recently as last week. If you're a retailer, the FDA is telling you to pull everything and verify the removal, not wait for point-of-sale flags.
How are hospitals handling the baby big demand?
California's IBTPP manages the national stock under an FDA program, and NPR reports they've been able to meet orders so far, even with the spike. Baby Big is expensive and specialized, but the program has experience ramping up during clusters, and it ships quickly by design because time is critical. Physicians evaluate infants based on clinical signs. They don't wait on lab confirmation to request treatment if botulism is suspected. Parents sometimes worry about the cost, but hospitals and insurers typically coordinate coverage given the urgency.
Any signs this outbreak is slowing?
It's too soon to say. The last reported illness onset was November 13th, just under 2 weeks ago, and because symptoms can be delayed and product was still on shelves in some places, officials aren't closing the book. The CDC hasn't posted a new case count since last week's detailed breakdown, and AP News noted that more updates are expected once lab testing catches up. The best way to slow it is simply removing the product from use and getting care quickly if symptoms appear.
What about families who used ByHeart earlier this fall but have healthy babies now? Should they still worry?
If it's been more than a month since the last use and the baby is well, the risk from that exposure is low because the incubation window is generally up to 30 days. That said, clinicians tell parents to trust their instincts. If a baby develops constipation with new weakness or feeding troubles, get checked promptly and mention the formula exposure. The CDC also reminds families not to feed honey to infants under 1 year, since that's another known source of spores, and to follow mixing and hygiene instructions for any powdered formula. The bigger picture here is to stick with recalled product guidance, even if your child seems fine. Don't keep it in the pantry.
Are there ripple effects in the formula market again, like we saw in 2022?
So far, the impact looks contained because ByHeart's share is small, but any recall can create localized shortages and anxiety. The Washington Post and business coverage suggest retailers are shifting shelf space to other brands, and WIC programs are authorizing substitutions where needed. If you can't find your preferred formula, pediatricians say most full-term babies can switch within the same general type, standard cow's milk-based formula to another brand's equivalent, while specialty formulas should be changed with medical guidance. The FDA has said it's watching supply closely to avoid knock-on effects.
Finally, what's ByHeart saying to parents right now?
The company is apologizing and asking customers to stop using its formula immediately while it cooperates with regulators and refunds purchases. In statements cited by U.S. News and World Report and PBS NewsHour this week, ByHeart said, quote, "We understand the fear and disruption this causes families, and we're working around the clock to support them and to identify the source of this contamination," end quote. It's urging parents to contact its call center for refunds and information, and to monitor infants for any signs of illness even if they used only a small amount. But the core message matches FDA's discard everything and talk to your pediatrician about alternatives.
Important guidance, especially heading into the holidays. Chloe, thanks for walking us through it.
You're welcome. We'll keep an eye on the case count and the lab results and update as soon as regulators post new findings.
Here are some other headlines. President Donald Trump has signed an executive order launching the Genesis mission, a Department of Energy-led moonshot to make AI the rocket fuel of U.S. research. Framed as a historic national effort on par with the Manhattan Project and Apollo, the initiative aims to double the productivity of American science and engineering within a decade. The plan connects all 17 national labs with universities and industry in a closed-loop platform, training foundation models on federal datasets to automate hypothesis testing and lab workflows. The focus: nuclear fission and fusion, quantum computing, advanced manufacturing, and biotechnology. Deadlines are dialed in. DOE has 90 days to map computing resources and 270 days to show initial capability on at least one scientific challenge. Energy Secretary Chris Wright tapped Undersecretary for Science Dario Gil to lead, coordinating with White House Science Advisor Michael Kratsios. By opening federal data vaults and partnering with firms like NVIDIA and Anthropic, the U.S. is betting deregulated, state-backed speed will outpace rivals and anchor national security and energy independence, turning red tape into green lights. In Taipei, Taiwan is raising a new kind of roof. President Lai Ching-te unveiled a roughly $40 billion 8-year special defense budget to build a Taiwan Dome air shield and buy advanced U.S. systems starting in 2026. The T-Dome would fuse AI-enabled radar with precision strike missiles for a multi-layered defense meant to deter and defeat aerial threats from China, an Iron Dome-style umbrella, Island Edition. Defense Minister Wellington Koo says the plan prioritizes U.S. procurement and joint tech development, aiming to boost asymmetric capabilities and reassure Washington after pressure to spend more. The proposal now heads to the legislature, as Beijing's objections meet Taipei's projection of resolve. Off Denmark's coast, carbon is going back where it came from, under pressure. The Greensand project, led by Ineos, is prepping the depleted Nini oil field to become what's billed as the EU's first fully operational offshore CO2 storage site, with commercial injections slated for 2026. Initial capacity targets up to 400,000 tons of liquefied CO2 per year, scaling to 8 million tons by 2030, with emissions pumped 1,800 meters beneath the seabed. Ineos Energy Europe CEO Mads Gade says the reservoir could theoretically store centuries of Denmark's emissions, turning wells of the past into vaults for the future and flipping the script from extraction to subtraction. On the home front, the Federal Housing Finance Agency is raising the roof on conforming mortgages. For 2026, the baseline loan limit for Fannie Mae and Freddie Mac rises about 3.3% to $832.750, with high-cost areas climbing to $1, $249.125. Effective January 1st, the shift nudges more buyers out of jumbo territory, lowering hurdles on down payments and credit, while the modest bump signals price growth cooling in the face of higher rates. It's a lending ladder that's a bit taller in a housing market that's a bit cooler. And online, X is putting an origin story on display. A new About This account feature flags the country of origin from sign-up and app data, revealing that a number of prominent accounts posing as U.S. political voices, pro-Trump brands like @Trump_Army and @MAGANationX, and some anti-Trump profiles, are actually operated abroad. One verified account, with more than 580,000 followers, was tagged to Eastern Europe. After backlash and VPN complaints, X briefly paused the tool, then restored it with disclaimers. Security researchers say the receipts reinforce long-standing warnings about foreign astroturfing, as the platform wrestles with trust, traction, and the true location of influence. That's all we have for now. Today's episode was made by Alexander King with GPT-5, Gemini Pro 3, Gemini Flash 2.5, and Google Cloud Text-to-Speech. I hope you have a great day. I'll see you tomorrow, Alex.